Welcome. Before we get started, in the spirit of reconciliation, Alongside Families would like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people joining this webinar today. My name is Bree, and I'm joining today from the lands of the Murrumarang people on Yuin country. I can see Emma's already popped in the chat, but if you do know what lands you're joining from, I encourage you to share in the chat. So welcome back for those who have watched our previous sessions. This is session 3 of the genetics webinar series brought to you by Alongside Families and the Genetic Alliance Australia. Over our first 2 sessions, we walked through those initial questions about genetics and made sense of testing results. Today, we're shifting that focus a bit to something that touches your daily life, navigating the systems and supports that make all the difference to your child and family. So if you're feeling a little bit overwhelmed by systems, whether that's the NDIS health or hospital systems, it can be hard to know where to start or how to make these systems work. If you're wondering how to coordinate care across multiple services or feeling like you're drowning in assessments, reports, and review dates, today's session is designed specifically for you. Or you might just be starting to explore those supports. Maybe you're wondering where to even begin, what you're entitled to, and how to prepare for that first NDIS meeting. Today, we'll give you some practical tools and confidence to take those next steps. So we are joined by some incredible speakers today who know these systems inside and out. We have Lauren, who brings her expertise as an NDIS Navigator at the Mito Foundation. So Lauren helps families access and understand their rights. She's also a qualified occupational therapist and has worked across government, private, and not-for-profit sectors, and knows how to empower families to advocate for the support they need. We also have Nika. So Nika works as a clinical nurse specialist and has over 10 years experience in pediatric nursing. And she's been leading the Navigator project, which is a pilot program providing nurse-led support for children and families affected by rare diseases. And so she spends most of her time connecting families with resources and supporting NDIS access. And then we have Helen, who brings decades of lived experience as a parent of a son with an extremely rare syndrome. Helen has worked with ACD Victoria, as both a support advisor and a community education facilitator. She works with Carers Victoria. She's a national carer ambassador. She works with Alongside Families as a Healthy Mothers, Healthy Families facilitator. And she has walked this path and now helps light the way for others. And I'm also delighted again to have Emma, the CEO of Genetic Alliance Australia. Emma's going to be monitoring the chat and the Q&A box throughout the session, helping to ensure we address your questions and connect you with the additional resources as needed. Okay, so let's just dive into this conversation because I know families feel like they're trying to solve a puzzle when it comes to navigating supports and services. So let's just start at the very beginning, the moment when that family realizes they need support. And I'm going to come to Lauren and Nika first. As 2 people embedded in the health and community support systems and meeting families at different points in their journey, what do you both tell families who feel completely overwhelmed and don't know where to start? What's the first step you recommend? So I'm just going to go to you first, Nika, because you're on my screen first.
Yeah, so great question. I would first say it's completely normal to feel overwhelmed. You've probably just been given a lot of information. You're taking time to process it. This is not a journey maybe that you anticipated taking. So just that's okay to feel overwhelmed. And then I feel like that's a very normal reaction. I think it's important in the beginning kind of to form a really good connection, I guess, if in my setting in pediatrics with a pediatrician or your GP, just someone that you really trust and have a good relationship with that can really advocate with you and for you, for your child. So I think one of the first things I would say is kind of really reach out to that care provider and they can kind of be with you because this is going to be a journey ahead for you. Yeah.
Yeah, absolutely. And it definitely is a journey. Lauren, what would you add to that?
Yeah, I would say really similar things. Taking one step at a time. Often, as Nika said, the amount of information that is given is so much, and often in medical jargon and that kind of thing. So it's really important to find that person. I also think sometimes people find those connections within peak bodies or organisations, depending on those diagnoses. So things like Rare Voices Australia, Genetic Alliance Australia, dementia, childhood dementia initiative, any of those peak body type organizations, often having someone on the line just to kind of say, this is where I am, can help to start processing and working through what those next steps might be as well. And I think connection is really important. Finding someone who is able to listen, has the time to understand you and your family, and support you through that journey.
Yeah. Helen, I want to bring in that lived experience. When you first realized your son would need ongoing support and services, what was that like? And where did you even begin?
It's a huge question with a long answer. But at the end of the day, it was something we didn't expect. So it was shock, absolutely unbelievably incredible shock. We felt overwhelmed and totally confused and out of control. Honestly, it was huge when we were told having a child, which we thought, everything's going to be fine. And suddenly we were told he wasn't going to even make it. So, and he had this complex, rare problem that they didn't even know what it was because there was no genetic testing at that time in that area. So, we felt deep loneliness because we couldn't find the peer connection, but like what was shared just now, is around finding the right supports, and that's where you feel a little bit overwhelmed and lost. But don't go it alone. That's my message straight away. Don't go it alone. You do feel fear. You feel helplessness. I felt guilt. Did I do something wrong when I was pregnant with Ben? But at the end of the day, I also felt guilt about my eldest son. I wasn't being an appropriate mother to him. He had a colostomy bag, so it was really hard to access community because every time we went out, it was literally a poop show, and we found it really tricky to go out into community. So the isolation and loneliness really did exist. The spontaneity was taken away from our world. And also that severe financial hardship. So the message in that is around seeking out an appropriate support. And to answer the question, where did I even begin? Obviously, it's finding the right time, self-care and emotion to take on board, what have I got to do? Find some resilience within to seek out the supports that you need. I had to fight for Ben. I had to fight for his life. And I never gave up on him, but sometimes it was really difficult and the exhaustion really did set in. So self-care was really important. And the first thing, as suggested by everyone, is finding a really good pediatrician. And we were blessed to find one. Yes, he was 80 kilometres away from our family home, but he actually had an idea of what Ben's diagnosis was, but there was still the genetic testing going through to find out what it was. And he was correct, which 4 years later, we found that out. So we were encouraged to stay connected with a geneticist, which was wonderful. We had an amazing geneticist who was very thoughtful, very kind, very caring, and had empathy for our situation. Also connected me with another parent who was in a similar situation. At the time, we got told there was no one in Australia. Then we discovered a couple, and now we've had found 20 people within Australia. So I'm glad I kept connected with the geneticists. And once again, 180 kilometres from our home in Melbourne. But at the end of the day, worthwhile. We didn't get offered genetic counselling at the time. I'm not sure if it existed, but this is something I would strongly recommend if it was available, or suggest it. And in those early years, the maternal child health nurse was really a very important key to us. She was the person come around to visit us every week. This is because Ben had so many complexities that, she could come to us and we didn't have to go out into the community to see her. So that was very helpful. We ended up attending a scope program in the early years, which was so powerful for us because we found that connection. of, I called them my sisters in disability, and we're still friends to this day. And I get a little bit teary just thinking about them. And also knowing those financial supports, because that's something that wasn't offered or shared with us. So knowing that they're there, that carers allowance, we did not know about until after Ben was 12 months old. So then we applied for the carers allowance, and that was something that was beneficial to us for financial reasons. We accessed the Noah's Ark Early Intervention Program when they opened a program locally. So I was living day to day, bottling up all the enormous grief and emotions and the fear of the unknown, and cancelling was not offered to me in those early years. But once again, it's something I strongly suggest to access, whether it be through the Carer Gateway or whether it be through another health service. But cancelling was something, and is something now, that I absolutely continue to use and strongly recommend. So that's a bit of a summary of what did I do and how did I feel?
Yeah. Thanks, Helen. And it sounds like from Helen's experience, there are a lot of supports that are out there, but I guess some of them are sometimes hidden in plain sight. So Nika, I want to come to you now. Like, what's one thing that makes this overwhelming for families is they don't know what they don't know. So what supports, both health and community based, do you consistently see families missing?
I think in addition to what Helen said about mental health supports for the carer, I mean, that's something that I try to bring up with families right from the very beginning, is that we just really normalize that there will be an impact on your mental health as the carer of a child with a disability or with, additional needs, and really just making sure that that's normalized. And then we talk about that right up front, and then we can kind of talk about the types of, sometimes there are free or easy to access mental health supports for families, specifically for me living with rare disease, that we can link to, and if anyone's interested, we can provide information about that. Just really from the beginning, I feel like that's missing. And of course, the families put their child's needs first, but I guess as a part of the holistic care, we really need to focus on the mental health of the family. So I feel like that's something that's missing often. I guess being across kind of the psychosocial supports, are they, as Helen mentioned, accessing the carer's allowance? Are they eligible for the carer's payment? And there's also something called the carer's adjustment, which is payment, which is, if you've had a really a longer period of where you haven't been, earning an income, or you're really financially, lacking for a certain period of time, and we can work together to kind of get documentation forward to give you kind of like a lump sum payment for that period. And that's something that a social worker could help you with. Like, for example, if you are known to the Sydney Children's Hospital network in some way, or I'm just speaking from where I work, if you see, say for example, you're known to a neurologist, when you see your neurologist next time, or you have your next appointment, to say, I would like to speak to a social worker, and they can make a referral through to that team just internally through the hospital. That's something that you can definitely do. So you're linked up with a social worker even as an outpatient. You don't have to be admitted into the hospital to see one. And yeah, just specific to rare disease, that there are obviously places like Genetic Alliance, obviously, and SWAN, Syndromes Without a Name, and other organizations where you can get that information and access to resources specific to rare disease. So I have a bit of a checklist that I go through with families, things like that, just to make sure that they're accessing these things. And oftentimes, they know what their child needs in terms of therapy and support, but we have to look at the whole family.
Yeah, absolutely. Thank you for adding about the social worker as well. I think there's a misconception out there around what kind of support social workers can offer. And they're actually a godsend. When you're in that situation of overwhelm and you don't know what's available to you, they can really help you navigate that. Lauren, from the NDIS disability support side, what are families often not aware of, especially at the start?
Yeah, great question. I think the NDIS is a very complex scheme. Whilst it's amazing and has changed the lives of many people, it does not come with no complexity. And it constantly changes, which also adds to the complexity. So you get your head around something and then something changes. So you have to get your head around the next thing. I think the most important thing early on is really around that connection with your early childhood partner or your local area coordinator. So this might not be new information for some people, but your early childhood coordinator is for children 0 to 9, and they are often allied health professionals or early childhood educators or teachers, so they have a really good understanding of childhood development, which is fantastic. They act as that conduit between yourself and the NDIS. So they're your ally. They're the person that's going to support the process. They're the ones that you want to have a really good connection with, who understand you and your child and your family. They're also there to connect you into other community services and organisations that are separate to the disability support, well, the NDIS specifically. So that could be things like your local inclusive play groups, or again, like Nika said, information around carers allowance and what other entitlements you may be eligible for. There are certainly times where, depending on a family situation, they can deal directly with the NDIS, so they'll have a straight path to someone working at the NDIS. If there is a diagnosis that's causing significant functional impact straight away and you need support urgently, there is a priority escalation criteria which prioritizes someone's access to the NDIS and then a plan. So these are things readily available on the NDIS website, but also that website can be hard to navigate. So looking at that priority escalation criteria is really important, especially if there is an urgency around support. And if your child is in hospital or having an extended hospital stay, there are health liaison officers who are new in health departments who have their own escalation processes around access and plan reassessments to ensure a safe discharge. So just knowing some of this information and being able to say to the social worker, oh, hey, can you connect me with your health liaison officer? We need to get this going. Sometimes it's not at the forefront. Sometimes there might be lots of things going on. So being able to arm yourself with this information is really important, because then you can, I guess, suggest it as well. And the other thing is really about the not-for-profit organisations. Not everyone will have a navigator role, but they should have a good understanding of NDIS processes and next steps, and where you might be able to seek some further support.
Yeah, great tips, especially around the health liaison officer. Really good to know. Helen, what's one support you wish you discovered much earlier in your journey? You know, what had the most impact early on, and any practical advice of how families can find similar supports?
So once again, apologies, I have more than one, because in those early years, knowing my rights to advocate and my right to speak up on behalf of my son, Ben, and my family.
We just lost you, did we?
Yeah, I've lost you. Can you hear me?
Yeah, we can.
And I can't see you.
We can see you. We must be hidden behind something on your screen.
I'm so sorry. Okay, I'll be back again. So in the early years, I wish I'd known my rights to advocate and speak on behalf of my son, Ben, and my family. A major game changer for me was learning that my voice mattered and that I knew my son the best. That's one of the best tips and messages I want to pass on. But seeking the medical opinion, a second medical opinion, is important too. Ben's had 63 anaesthetics, and he's had thousands of hospital admissions, and he has now 5 hospitals. So in the early years, we only had 1 or 2, but now we've got several. And so seeking that second opinion was really important to me. You'd be told something and be given a very bad scenario. I went on and got second opinions, and the scenarios then could balance themselves out. Social worker within the hospital, which was already mentioned. We in Victoria have disability liaison officers, and they have been absolutely brilliant. They are absolutely already appointed. When they know someone with a disability is coming into the hospital environment, they are appointed. Royal Children's Hospital, obviously there's a lot of children with a disability going into the Royal Children's, but when you go into the adult world, the disability liaison officers are there as well. So they are very helpful. And as I said, when we enroll now, when we get admitted into a hospital, straight away, the disability liaison makes contact with us. Then also has an autism care plan on the front page. Apparently, when he walks in now, we come into the Austin Hospital, for example, the autism care plan is action straight away. And that's around all his sensory levels and everything that he needs and everything he needs within a room environment. So that's so well planned. So once again, don't hesitate to plan ahead and ask for these supports. One support I wished I'd accessed more was the peer support groups in those early years. At first, a peer support group for me was overwhelming. I saw children running around, dancing, playing, reading, playing with each other, and I had little Ben that was very vulnerable and unable to do any of the above. But over time, I realised how important and enabling these peer support groups are. And so my time didn't exist in those early years with my Ben, but now they do. And so I encourage each and every one of you to reach out and access either the face-to-face My Times or the virtual My Times. And Alongside Families run a fantastic array of virtual My Times. So I encourage you to also access those. Accessing services like's been mentioned, Alongside Families, SWAN, Syndrome Without a Name, ACD Victoria, Family Advocacy New South Wales, and the list goes on. The Carers Association. So in your state and territory, everyone has access to a carer association. They run some fantastic supports for you as carers. So I strongly recommend you to link to your local state or territory carer association. Carer Gateway, register with them because their supports are surmountable in what they can offer. And connecting with disability-specific orgs, as already been mentioned, I connected with Amaze Connect, which is for autism, with the Genetic Alliance Australia, with Rare Voices, with SWAN again, and GSNV for us in Victoria, the Genetic Support Network in Victoria. And also the carer supports has already been mentioned. I'm so glad, Nika, you've mentioned the care adjustment payment. Many families aren't aware of it. And you do have to apply for it within 2 years of the diagnosis for any child aged 0 to 7 years of age. And it's basically based on a catastrophic event. That's what it's all about. And even families, children with complex disabilities, but children with any diagnosis can be catastrophic to the family. So I'm saying apply because I know of many who have and received. So that's a really good hint that you provided. And finally, become a workshop stalker. That's my message. I go to so many workshops that are available right across Australia to learn and be skilled up, but connect with other families, the peer support component of it. I actually even go to Cincinnati overseas, internationally, and I join a webinar there with the University of Cincinnati who are specific around the syndrome of my son. And so there are organisations, hospitals, universities internationally for those with rare diseases, rare diagnoses that you can link with too. So that's just a little bit of a hint and tip of the supports in those early years.
Yeah. Thanks, Helen.
I told you I had a lot.
I just want to talk about a little bit more about the NDIS, and we know that it's a big part of the puzzles. And, we want to sort of know what families should know even before they apply. So, Lauren, what do families need to know up front, and what groundwork going into the NDIS application makes the biggest difference?
Yeah, sure. So I guess I don't even know where to start. So I guess up front, it's really about knowing what the NDIS stands for, or how you can get into the NDIS. So the NDIS is a national disability. It's an insurance scheme. So that's what the NDIS stands for. When we're talking with children or around children accessing the NDIS, children can access the NDIS under early intervention, which is from 0 to 9 years of age. And this is around maybe not fully knowing the extent of what their disability needs might be in the future, or that with early supports and therapy supports and building their capacity, that the child may not need lifelong supports. And then there's obviously the disability pathway, which is stating that a child will have lifelong or need lifelong disability support. One of the really tricky things within early intervention is there is the term developmental delay, and that talks about when there's a significant delay in 2 or more developmental areas. And sometimes children can access the NDIS under this term developmental delay when there is when people are unsure about whether or not there is a diagnosis, something's going on, but we're not really sure about what that is. So there are a few different avenues. What I would suggest is, when you make contact with your local area coordinator or your early childhood partner, is to have all of your documentation ready to go. Have it all ready to go, because we don't want there are often time delays with the NDIS, and having it ready to go just means that you can submit it all at one go. We want to be able to use their language, and I know that this can be really difficult because it is deficit based. But in my experience, what I've seen is that if it's not clear, then sometimes the NDIS has difficulty in understanding that your child's needs or what your child's needs may be in the future. The evidence from specialists should reference eligibility criteria and use NDIS terms such as, prognosis, if treatment options have been explored, discuss your functional impact. Again, I've seen, and I appreciate that medical professionals are really busy, but if they have a letter that includes a lot of other medical jargon or information that's not relevant to the NDIS, that this can actually complicate the process, and it can kind of move away from what it is that we're actually applying for. So making sure that we have a letter that is specifically to the NDIS around the disability support needs. And I guess really highlighting that there are so many different types of diseases that cause disability, and that there is no one person that is ever going to be an expert on all of those. So giving them as much information about the functional impact, because even with the same diagnosis, that functional impact can look different. And so that's really important. I think the other thing for me that's really important is that it is always a person's right to seek access, whether or not your early childhood partner or your local area coordinator might say, oh, well, you could try these community supports, or you could try accessing Medicare. Every person has a right. It is your right to access the NDIS. So if you would like to do that, then that's what you say. I would like to access my right to apply to the NDIS, regardless of the information that they want to provide.
Yeah, great tips. Nika, I want to bring you in here now. How can healthcare providers support families with having a strong application?
Yeah, that's a good question, and it is really tricky, because one of the things I feel like we come up against when applying for the NDIS with families and kind of supporting them in that process is that, say, you could have two children with the same condition with they're almost identical letters, and it depends who's reading that letter as to how the support that you might receive, which is, entirely unfair, and that's something that we, really come up against. But I think one of the things, I guess, in genetics is for health professionals to keep in mind, and, for families to keep in mind when they receive these letters is, the people reading them often won't have an understanding of, say, genetics or medical terms or jargon. So to keep it something that most people can understand, and often the list of conditions that are listed on, the NDIS from their perspective is not going to include nearly any of the genetic conditions that the children that we see would have. So really being specific that, they have this condition, or which is a lifelong permanent condition for which there is no cure. I guess we need to be really specific. And I often, speak with families and saying, the words that we're using in this it's quite, stark, and it might be confronting, but we have to kind of use that language, unfortunately, in the letters to kind of get across the line that this is, a genetic condition in nature is permanent and lifelong. And I guess kind of speaking to your health providers in exactly what you need, and advocating that this is what I need, and this is how it's going to support my family, and these are the goals, and this is how this therapy is going to, impact the goals that we have for our child. Just being really specific, and there's no harm in asking and really advocating and fighting, for what you need as a family. And I think another really strong thing is, I guess, for the families, providing a really strong carers impact statement as well. And
yeah,
and
I saw Okay, go,
Sorry,
Lauren.
Bree, can I just jump in on there?
Yeah, absolutely.
Nika just reminded me of something that I have seen a lot of the time is also within that request around what you might need for therapy and those sorts of things. Something that's often missed, especially for children with complex needs, is around that forecasting or that what might be needed in the future. So for children that those developmental milestones between 0 and 2 are so significant. There's so much that is happening there. You might not need a piece of equipment today, but you may need it in 8 months' time, and you don't want to have to be reapplying to the NDIS. So always asking for things like assessment hours is super important. Yes. Because you want to know that you can get access to those types of things at the time that you need them, and not when it's too late, or you've kind of missed that opportunity.
Yeah, that's a really great point. And especially with children, if they have a physical disability and they're growing, they outgrow equipment very, very quickly. So it's always good to have it in the plan. I was going to say, I did see Helen's eyes light up when we talked about that carer impact statement. But Helen, I want to ask you, what made the biggest difference at the start of your NDIS journey, and what do you wish you'd known earlier?
Yeah, well, I wished I'd had Nika and Lauren in my background to help me out, because at the end of the day, everything you've shared was absolutely powerful. So thank you. But being prepared. That's my key message. Don't leave everything to the last minute prior to the planning meeting, or when you're applying for the NDIS. That can be a process that it takes time. So making the time and being kind to yourself. I actually had to take carer's leave to actually work and sit down and think and have some space, because that's what it needed for me, because my son was so complex and I had to gather so much information. So the evidence reports are the key. You can say as much as you like in a planning meeting, but truly it needs to be in writing. So the evidence reports from the various supports that are wrapped around your child or children are so important. And what I actually did, and I know it might be a bit nerdy, but I read the NDIS price catalogue, because when you read that, you actually get the words that you can apply for the support. So I actually, with respect, I asked all the evidence, the people who were providing me with evidence, so all the specialists, all the allied health team, I actually wrote some words for them to ensure they included them in their reports. I asked with respect for a draft report to be sent back to me so that I could offer and contribute some additional information. Now, I know that's not something for everyone, but it is something, a right that you can do. You can ask for a draft report with respect, just to say, can I include, and ensure consistency of messaging, because that's really important too. So that's a really important tip I felt in those early years. And I wished I had done it at the beginning, but I know I'm doing it better now. The task breakdown of increments. Now, a delegate actually told me, if you're seeking supports for your son, you must do an increment breakdown over a 24-hour or 48-hour period of what supports and why you need support workers. This was around the support worker side of things. Why and when. And so every hour over 48 hours, I provided with what the above and beyond parental responsibility I was doing to support Ben in his personal care. And who else was helping me? So it could have been my husband. It could have been a support worker. We had sometimes had a support worker, or it even could have been also included a therapist at the time. So all these people were involved in doing the support for Ben, and those therapists wrote this evidence in their reports around the enormity of the supports that's needed, especially for those with complex and rare diagnoses. So it's just important to think about this. Writing a carer's impact statement, thank you for mentioning that, absolutely paramount. And I actually get my GP to back it. So just to get a GP to say, Helen requires everything she's requesting, and including all the specialists that are requesting supports for Ben, because she has her own health issues as well. And it doesn't have to be stated what. So, I may have had a physical challenge, I may have a mental health, emotional challenge. I also may have just, be taking some form of medication. But he just wrote, that is important to provide the support to Helen to continue and sustain ongoing care of Ben. They were the easy words that he wrote, and and I shared the carer statement with him. And actually, what he read in that, he didn't know as much. Like he said, whoa, I've been with you for 25, 30 years, and I didn't know half of this. So being prepared to justify is another important component, because a lot of the NDIS will just say, no, you can't have that. So when you need a support coordinator, for example, or you want travel, or you want parent carer training, or low risk assistive technology or consumables, I actually just got a document, an A4 document, wrote the title and started writing all the justifications of why we needed it. And that worked really well. Another little tip and hint, have your the child's NDIS number on every document that you send off to NDIS so it doesn't get lost. And sending it in early to the delegate, email to the delegate and email to the NDIS inquiries. So I always ask the delegate for the email address. So and so I think that's a bit of an understanding, because we're going to lead into more questions shortly. So
and we're definitely going to run over time.
sorry.
That's okay. Lauren, what's your advice for families as they prepare for planning meetings or plan reviews? Like, what's the best way to approach these important sessions?
Yeah, so we've definitely touched on some of that already, even with just applying and that whole be prepared, be as prepared as you can. There have been recent changes to the way in which planning occurs. And so now the Early Childhood Coordinator and LAC will collate all of your information based on your meetings with them, any of those evidence and reports. They then upload this into the NDIS system, and you go into another kind of waiting line for an NDIS planner to pick you up. So, and the planner is now national, right? So you can have a planner from South Australia call you in New South Wales. So that is definitely one of the things I would say. Confirm your time zone. I've had many times where a planner from Perth has called someone in Queensland, or they've had the wrong time zone, and it's been an absolute disaster. And we all know that no one has direct access to emails now, email addresses to people at the NDIS. And there are times delays with the NDIS inquiry email getting to the right people. So it's really important that you confirm time zones when your planning meeting is going to go ahead. And it's likely that the planner will call from a no caller ID to organise a meeting. So the NDIS won't leave you a voicemail unless your voicemail specifically says your full name. So it has to say Lauren Buck. Otherwise, they won't leave you a voicemail. If it says your full name, they will leave you a voicemail. You need to have all of the evidence, all of the reports requesting what it is that you want, because without this, the planner's not going to be able to make that decision for your specific needs. They will make their decision based on the NDIS information that they have and what it looks like for them on the other side, but it won't be necessarily individual. My suggestion is always to ask for the meeting to be a video call, and Teams is the preferred video call option for the NDIS. I think it's really important to have a face and a name, and even for them to see your child, as opposed to just being another voice on a phone. You can also say it's a bad time for you to call me right now, and ask for them to email you with preferred dates. I know that even I might get a text message at 5 o'clock being like, someone from the NDIS is going to call you. I'm like, but I'm finished work at 5 o'clock, and as a parent, your job is never done. So 5 o'clock is probably the worst time for someone to call you. But it's okay to say it's a bad time. Can you call me later? Can you send me an email with preferred dates so I can get everyone that I need to be able to attend that meeting with me? So, those are some of the tips that I think is really important. You want to have ideas about your goals leading into the planning meetings, and these might change as well, but I often say try to make them as broad as possible. I want Sophie to feel safe and supported at home, or I want Vanessa to be able to communicate her needs and wants, because then your therapist can be really specific about what those goals look like for the child. Know your rights, particularly around the review processes, what internal reviews look like, what the timeframes are, and the administrative review tribunal. Know that there are options if you are not happy with your outcome. and really advocate for what works for you and your family. I love, like, the carers impact statement's really important, especially for those children who have really significant complex medical needs, where parents end up becoming doctors and nurses, and that's not what would be considered typical. And so being able to explain that to someone, to say, well, actually I have to roll them, they're 3 and I have to roll my child 7 times a night. For a 3-year-old, you would expect typically that maybe they might wake up once but be able to put themselves back to bed. So really highlighting what life looks like for you. Otherwise they don't understand, unfortunately. One of the biggest things at the moment that is causing a lot of difficulties is around the funding periods. So this was something that was brought in earlier this year. So I always just ensure or ask people to advocate. You can advocate for changes in those funding periods. I'm always advocating for maybe a 6-month funding period, and that things are front loaded so that you can get assessments and things as you need them, not kind of spread out equally for the months ahead. So yeah, I think that might cover everything, but I might also jump back in when Nika and Helen speak.
I'm thinking I might move us from the NDIS, because I feel like otherwise we'll be here all day. I might move us into sort of navigating some of those health and community systems, because I'm very mindful of the time. So obviously healthcare coordination and that day-to-day reality of managing multiple systems can be a challenge. Nika, I want to bring you in here. With your clinical background, how do you help families navigate complex healthcare systems and juggle multiple appointments and demands? What strategies work best?
Sorry, I was just mute. That's really hard. I feel like there's a few practical things I guess I can think of aside from what we've spoken about already. But I guess sometimes I've seen families where there's multiple carers involved. They have a joint email address where kind of provide that, where everyone then can agree across, these communication from the care providers. I feel like that's a really good thing that I've seen where, one person isn't left out, or there's not just one go-to parent. I often find, whenever you call the first person that's on the list, or you send the email to the first name on the list, but I guess it doesn't include everyone that might be involved. And I think one of the main things I would say is really develop a good relationship with your pediatrician and also your GP. So, I mean, you can't see your pediatrician all the time. I mean, the financial cost, or if you're in the public system, the time constraints and all the, the limited availability. So I really, having a strong relationship with your pediatrician, whether that's in the public or the private system, and then also having a GP that you connect with that has, that's interested and that has time to sit with you and discuss your needs. I feel like that's a really good thing to keep in mind. And in terms of kind of coordinating multiple appointments, I would say if you're linked in with either the Sydney Children's Hospital Network, or if you live rurally, and you have multiple specialists and there's lots of people involved, have a look at the kids' GPS navigation system. So we can provide some information about that, but they kind of help facilitate care closer to home. If you've got a local hospital that's outside of Sydney, and other teams involved, they can try and kind of coordinate your care. So speak to your care provider, your pediatrician, your GP, someone about, and also, like, if you're known to a team within the hospital, ask if they have care coordination services. So you say you're overwhelmed, you can't manage all of these appointments and all these schedules by yourself. Often the neurology team, the epilepsy, unit, they will have a nurse or a care coordinator associated with that team that might be able to, have a look at your case and see if they can provide extra support.
Yeah, very great tips. Helen, how do you stay organized with all the appointments, reports, reviews, and paperwork? What system works for you? Is there a system that works?
Obviously, amplifying organizational skills is important, but also I don't do it alone. I've taught support workers around me to help me out with that. I rely heavily on my mobile phone diary, a paper diary, and request calendar invites for everything. So if anyone wants me to do anything, a telehealth or whatever, send me a calendar invite, which most do. I actually get a text and an email these days through the medical world. medical world is all paper based. So whenever, they don't send anything electronically, it comes in a paper format. So I also have a paper formatted diary system, which once again, I get the support staff to help me file. And yeah, just being on top of things. And when things are becoming too much, seek out the supports from the village, the tribe around you. Don't go it alone. So, but organization is paramount when you're dealing with NDIS and complexities.
Absolutely. Now, communication and coordination between services and providers can be a little bit tricky. Lauren, how do you help families help their healthcare providers understand their NDIS supports and vice versa?
Yeah, it's a really great question. I mean, I think one of the most important things is to share the information. And specifically, I've seen this work in the past where I've shared a letter with someone that actually hasn't initially met access to the NDIS with their health specialist to say, these are all the reasons the NDIS is saying no. Can you write a letter that actually, addresses all of these points? Literally word for word, because we know that, again, it's the wording that's really important. So encouraging everyone to use the same wording so that everyone is on the same page. Make sure that you have a team that wants to work together and that can collaborate, because you don't want to end up being this kind of middle person, which I think in the end we do. But yeah, just having that sharing of information and being really clear about what your expectations are and what your timeframes are as well. I often send emails to medical professionals saying we need this by this date, and then give them a 2-day grace period, and then I'm following up with another email, because that's also really important.
Yeah. Nika, in your role, what have you seen work well when families need to coordinate between health services and NDIS providers?
I feel, at first it is a really good, as I mentioned before, a relationship with your care providers, whether that be your pediatrician, your GP. That's, I think, really paramount, making sure everyone's on the same page. So, if you're asking for, if, one provider is asking for something, it needs to be consistent across with everybody. And one thing actually I wanted to mention that we're working on at the moment in our program is kind of creating, like, we're calling it a rare disease passport. So a document, that outlines, the rare condition, how it impacts the child, the key things that treating teams should know. This is how, this is what's already involved. This is who's already involved, kind of contact details with, all the clinicians and then the therapists and the family. All on that one document. Often families, they have to mention their story, 10 times to 10 different people if they've got multiple appointments. And so something like that, which I've seen actually some parents create one of their, if they don't have access to, a care coordinator or a navigator that can help them with something like that, then I've seen parents kind of make a document like that on their own with all the information that they need to know about their child. And I feel like that's quite helpful as well when, there's lots of care providers and therapists involved.
Yeah. Helen, Nika's just mentioned keeping everybody on the same page. How do you do it?
Yeah.
Is it possible?
It is possible. So I ask every allied health appointment, I always say, let's go for 45 minutes and allow an extra 15 minutes. Just send me a little summary of the allied health appointment, because sometimes I'm not at them all, because Ben's taken podiatry, his physiotherapy, music therapy, every one of them. Send me a little brief, just a little few liners about what happened. And then I've got something that I've collated and can share with others. For example, his physio report, little summary goes to his orthopedic surgeon. The dietitian summary goes on to Ben's functional gut clinic gastroenterologist and his infectious disease doctor. The GP forwards a blood test every week to me, and I send it to his hematologist. And so, there's a lot of networking and trying to collaborate everyone together to make sure we're all on the same page. But twice a year, we try and run a roundtable, virtual roundtable, that everyone's in the room, and I've shared all the documents appropriately and everyone can ask others questions. I also give permission for them to contact each other. So that's one thing I do put out there in at the very beginning. And when I'm taking on allied health professionals, I interview them, and this is my expectation of what I'm needing. And so they need to be on the same page with me, and that works well. I also am in a regional area, thin market, so I don't rely on local services. I actually go beyond local to be able to get. So our dietitians in Melbourne, for example, and gastroenterologists and everyone else is all 180 k's from our home, but it's all virtual. So so it works really well. So yeah, it isn't easy, but it can be done. So I hope some of those tips have been helpful.
Yeah, and I guess it takes a lot of advocacy and problem solving. And sometimes families do need to advocate strongly for what they need. Helen, I know that you have extensive advocacy experience. What advice do you have for parents who are just learning to advocate for their child?
I think just knowing what advocacy is and raising children in network state, advocacy is promoting and defending a person's rights, needs, and interests. So just knowing that through the Raising Children network, and knowing that your child with a disability has rights in all life areas. And I had the list, but I won't go into it for time reasons. But it's important to identify advocacy issues and prioritise. So when you've got a problem, think about what do you want to address and come with a solution. Like, don't just hopefully just lay it all out and not know what you want responding from it. Don't go through advocacy alone. That's my biggest tip. Take someone with you in every setting. When you're writing something to respond, it's a good idea to have everything in writing. Make sure someone else reads it before you send it, so there's not too much emotion in there, not too much individual attacking, as I say. It needs to be very respectful. So yeah, so that's just some of the very quick key issues around advocacy. And go to workshops, be a workshop stalker, and they're all out there and they're
we just lost
free. So find out what's out there and access them.
Yeah, and we actually run an introduction to advocacy workshop, which is really nice for those families at the beginning of their journey. Lauren, when families face barriers or rejections, what strategies do you recommend, and how do they know when they can push back? You're just on mute still.
Yeah, sorry, I took the breath in and then. So look, I think asking for things to be clarified, particularly like in writing, and this is particularly helpful with the NDIS. Any one of the partner organizations, because then we have something to work on, and then we can send it to other people for their advice. I guess, I often see people, need to strengthen their case and gather further evidence and information. Even if we think that the information provided already addresses what they're saying is not there, making sure everything is covered and in the way that the NDIS wants it to be. I think similar to Helen, it's really about knowing your rights and knowing that it's okay to feel confident to ask questions, to trust your gut, to call people out when things haven't gone the way they should, or you don't feel okay about the way that something has gone. I'm really, really I feel so strongly about giving the NDIS feedback because unless they know what's happening outside of their bubble, they won't make change, and giving them those examples that are real and that are about a person and about a situation is really important. So I think one of the other things that I love is that the NDIS has a participant service guarantee, and so this helps people to know when to push back. So know the time frame. So currently the NDIS stipulates it will take them 21 days to decide who needs access to the NDIS. So, if you've been waiting for 22 days, get in and speak to your early childhood coordinator. Put in a complaint about that. It's not about it being a squeaky wheel. It's about, making sure that they're held up to their end of the bargain to say, you said it would take you 21 days and it's not. And I can tell you, I've seen people sit there for much longer than 21 days. So it's really important to have a voice and to be heard.
Yeah, absolutely. Nika, I'll bring you in here. When you're supporting families through challenges with services, what approach tends to work best?
I think if it's very specific challenges, say for example, we just have to look at what we're asking for. So if you're looking at do you need more therapy? Are the hours inadequate? So then going back to your your providers and getting, I guess, collecting that evidence again and putting that together. I mean, you're always entitled, if you're not happy, to review and push back, and then question why things weren't given and why things didn't go according to what you're asking for. So I mean, if another thing I wanted to mention as well, and I think it's been mentioned before, is that if you're admitted to hospital, for example, your child has had a regression in their behavior or their presentation, and they now have increased needs to what they had before when your plan was in place, you can get an internal review of your NDIS plan. So for example, if you're admitted in the hospital and your needs have changed, that's actually a good opportunity to reach out to your treating team and say that you want to speak to the NDIS support person in the hospital. I'm just speaking on behalf of the Children's Hospital at network, and see if you can kind of get an internal review of where you're at, and that when you go home, you're going to actually have increased needs. You're going to need more support when you go home, because in light of the recent events. So that's something to keep in mind. And I always say you can encourage families if you're in a place where you feel stuck and nothing's changing, and you're really feel like you're left in the lurch and things, your plan doesn't match up to what your needs are. Speak to your local member. I mean, I have had families that literally they will go to that office and they will make an appointment and they will speak to their local member of parliament and really advocate one-on-one. And I don't know if necessarily that's that it's unfortunate that we have to get to that stage, but I encourage families to write a letter to their member of parliament or speak to them. Yeah.
It is a lot that falls on families, and there is obviously that emotional toll, and it does have an impact on their family when they're navigating all these systems. Helen, how do you manage the emotional toll of constantly advocating and navigating so many different systems while caring for your son?
Some days can be easier than others, and it all depends on the issue that we're trying to address. So picking the right time for me is important, and knowing my energy levels at the time to take on the advocacy issue. So we've had advocacy issues under education, post-school options, Centrelink, medical institutions, NDIS. We went to internal review and ART just last year. So yeah, we've had a lot of advocacy requirements, and I find that everything what everyone shared is really important. And MASCO, Member and Senator Complaints Officer, every federal member has a MASCO that sits in the NDIS, and they are really good representations if you can't get anywhere. So that's another good advocacy tip in here. But knowing that it's okay to complain and knowing to give feedback is really important too. So that's how I manage. It's around understanding the system, understanding the complaints process, and putting forward. But self-care is a key around advocacy outcome, and knowing that your limits, and being kind to yourself, and not going through an advocacy issue alone. I'll keep saying that. Don't go through this alone.
Yeah. Nika, what signs do you look for that suggest a family might need some additional emotional or practical support?
I'm not sure if I look for signs exactly, but I just kind of assume that all families that are in this kind of journey will need additional support. So, and I mean, they will need someone with them on this journey. They will need mental health supports, for either the young person and the family as well, and the carers. So it's just something to keep in mind, I guess. If there are people, for healthcare providers, I guess at the back of their mind is at front of mind really is that all of these families will have additional needs, and especially thanks to mental health supports and resources that the families can have.
Yeah, absolutely. And I think it's about being proactive with those supports as opposed to reactive. So tapping into them before you actually feel like you need them. Lauren, how do you help families maintain hope and resilience when these systems do feel overwhelming?
Yeah, it's really hard, and I have a really unique role at the Mito Foundation where I am the NDIS Navigator. So I feel a lot of the time there's a lot of validation of this is complex, this is hard even for me, a professional who's worked in the space for a really long time, let alone someone that, it ends up being a second job really for many families. So I think so much of it is being there to help validate their feelings. I guess it's helping them also focus on what they can control. So making sure that, they're not biting off too much at all the one time. Of course, looking after themselves and providing options. The Carers Gateway is a really great one that Helen brought up earlier. But yeah, I think in my role, I've often found that I'm a sounding board because in my experience, a lot of families and people navigating the NDIS feel like they've lost a little bit of trust around those who work for the NDIS. And so they often need someone on the outside who can provide that validation of, no, this is it, or yes, you're worthy of the NDIS, and yes, you're worthy of all of these supports that you're asking for, because sometimes just those supports to get parents and families through every day are being, turned down, and that's obviously really difficult. So
yeah, absolutely. All right, well, we are just moving into the last few questions. We are over time, so for anyone's watching, we've just got a few more to go. I just want to talk about building your support network and maybe a little bit about planning ahead. But Helen, how do you prepare for those transitions? Like as your child's getting older and you're moving between those different types of services?
Planning, preparing, exploring. We actually went to different places, and some places even said, oh, Ben's too complex for him to attend, our service or whatever. That's actually discrimination. So at the end of the day, also knowing your rights. Some transitions can be easier than others, like our kinder to school, brilliant. We went to a mainstream and a special development school, so we dual enrolled. That was brilliant too. But leaving school, going into the adult world, it was very tricky. And exploration was really difficult, and opportunity wasn't a lot of. So I'd like to bring them into the NDIS, thinking that actually it's their responsibility, duty of care and obligation to support your individual to have the best life. So Ben actually ended up getting, finally, post-school was one-on-one support throughout the day. And then now, as time's gone on, we've sought 24/7 care, and he now has that as well. So that transition, even from hospitals, from the early the children hospital to the adult, was tricky. But once again, planning, investigating, researching, asking questions, and preparing the next step. Preparing those people that are going to be supporting and being in the team around your child is really important. And go to workshops, because many organisations like Belongside also run workshops free of charge for parents to come along and hear about what opportunities are available. And peer support, getting that information from other parents, is absolutely valuable. What did you do? What did they do in the transition of whatever that stage is?
Yeah. Nika, Lauren, what advice do you give to families who are preparing for transitions? Nika, you've got yourself off mute.
Yeah. So I'll speak from a hospital perspective, I guess, is be prepared. Know the kind of, your child's, right to be at childcare and to have an inclusive environment at childcare, at school, in sporting or other activities that they want to, you want to have them in and they want to participate in, that there should be means for them to participate in these, and using kind of, and making sure that these are included in what you're asking for, if they need special provision, that kind of thing. And then in terms of the hospital, we have a service called Trapeze, which is the transition service for when you're kind of moving on into adult services, and they facilitate links between your current services and in your adult service. So start thinking about that 13, 14 years old, and then see if you can get linked up into that team, and then start thinking about it early, because you don't want to turn up one day at 17 and then all of a sudden they say, oh, you actually go next door to the adult hospital. That that obviously wouldn't happen when there's a very complex situation. But when I used to work in the emergency department, we would have to redirect some families who had a significant history at the children's hospital next door to the adults, and you're completely lost, and that support system might not be there. So yeah, think about it early, and speak to your team about what systems need to be in place for that transition.
Yeah, yeah, it's hard. You spend so long building this team, and then, you know, we age out and it's like, oh my gosh, what's next? Lauren, do you have anything to add there?
Not really. Look, I think prepare, prepare is and early. And I think it's okay to say I don't know, and to try and find someone with that source of information, particularly around, you know, when you're transitioning from even from early childhood to the LAC or the local area coordinator space, that changes. And then obviously, yeah, finding the information to then so that you can make an informed decision and know what's right for you and your child, I think is really important.
Yeah, absolutely. All right, final question. What advice would you give to families about connecting with other families, finding peer support, building a network that can help them navigate these systems? And I'm throwing that out to anyone that would like to answer that question. Helen, you've mentioned peer support.
I have, and that's what I was going to say. Peer support from other parent carers that have lived the journey or living the journey, and you can walk along with them or, you know, behind them. But yeah, peer support is key to learning around disability, gaining the village and the tribe around you. And I'm a member of the Alongside Virtual My Time groups and the Complex Medical My Time group, which I find really valuable. And I participate in NDIS Self-Management Peer Support Group in South Australia. I'm part of a housing hub that is ran through another Queensland organisation. So I'm just linking in to as much as I can to learn. And these are of nights, you know, and they can be recorded. If you register, you can listen to the recording. So
Yeah.
I know it sounds a lot, but it's valuable to me. And I listen to them in the car, you know, when I'm driving or things like that. So it's not really parking extra time because you can get to hear it all.
Yeah. Any final thoughts, Nika or Lauren, on finding peer support?
I think yeah, the connection with peer support is really important. Sometimes it can take time, whilst that family is processing kind of everything, and you know, I guess it's that prioritizing, you know, is it my NDIS application and all of the medical appointments that I have to go to, and then, you know, once everything's kind of stable, or, you know, we've got a hold on things, then we'll look to that. But I think so much of it is about you know, having a village where you can ask questions, add to your knowledge base, and then yeah, again, just helps you make these informed decisions that are right for you and for your family, and knowing, I guess, what everyone's experiences are. And I think the internet these days has really allowed for most amazing peer support groups. I mean, I know that for Mito specifically, there are groups in America, and, you know, it's just really interesting to see how things are being done. And, you know, there's advice around equipment and assistive technology and all of those sorts of things that you may not get access to if you don't have those connections. So I think it's really important.
Yeah, amazing. Thank you all so much for your insights and your expertise. I know we've covered a lot of ground, and I know every family situation is unique. I know I can't see any questions. I know Emma's been quickly adding in resources. I feel like there's going to be a lot of resources added to the email when we send out the recording. But yes, I just want to thank you all so much for your time, and to everyone who's watching and joining us today for this third session. I hope that, you know, you've been equipped with a few extra strategies to feel more confident in navigating the NDIS, coordinating care across different services, and advocating effectively for your child's needs. I think it's really important to remember that learning to work with these systems takes time, and it's okay to ask for help along the way. So start where you are. Don't be afraid to ask questions, document everything. Remember that you know your child best. Trust the knowledge, trust that knowledge when you're advocating for your child. I just want to share about our final session, which is happening next week, Shaping the Future. So we're going to take a step back from that day to day to explore the bigger picture. We have Dr. Emma Palmer and Chris Pierce, who will discuss research opportunities, long-term planning, and ways your family can contribute to positive change in the genetic space. I have shared the link for that in the chat for anyone that would like to register. And I guess that session is going to be about hope and possibility, and exploring how your family's journey can not only benefit from advances in the field, but also contribute to creating better outcomes for future families. So yes, thank you, everybody. I'm sorry we ran a little bit over. I hope this doesn't make your day run a bit late, Nika, Lauren, and Helen. Emma, thank you for looking after the chat again for me. And yeah, I look forward to seeing you all again in an online space sometime soon. So have a wonderful rest of the day. And again, appreciate your time and your input into today's session.
Thank you. Thank you, everyone.
Thank you.
Thank
Go well.
you.